started losing like range of motion.
Okay.
Do the ART, get the range of motion back.
Okay. Now, when you say range of motion, is it more extension, flexion, or is it supination, pronation,
No,
or all of it?
extension.
Are you familiar with the neurological connection from the neck to the elbow?
No.
Okay, we're going to go over all that.
Okay.
You can see this side is higher, but this side is more developed. So the question is it coming from some sort of spinal alignment where the muscles are working asymmetrically? Or is it actually that one side's not getting the power there? We'll check that.
That's your job, man.
Yeah, that's my job. I got it.
I had like major surgery on my knee.
ACL?
No, I had a patella tendon repair. Glass went through there and severed the whole tendon. I got it reattached.
Your mechanics are different.
Yeah, that's
Absolutely.
what I think.
So if one side was off, you were rehabilitating it, you were obviously favoring the opposite side. The question is, whatever happened here, okay, remember, it's all connected.
Yeah,
It all goes back to pelvis and spine. So right now I'm just doing a visual. And what are the big things that we see? There's not a lot of asymmetries, but the shoulder is off a little bit, okay? We want him to be sitting like this will be his new normal. That's what I want for you. His right scapula is actually posterior lateral. It's out this way. So that's part of what's turning the shoulders or making it look like it's asymmetrical. But it's actually not. It's coming from here. All right, so as we're running the meter, we're getting a big reading here at Atlas on the left side. All right, 2.7. All your stuff is left-sided in terms of your pressure readings. Next thing we're going to do is static palpation. You can see the tissue changes start there, right to where the break is there. 7 more tender or 6? I feel 7. That's the sugar button too. Now, just looking at your spine, and I'm seeing the straightening of this, I know there's a pelvic issue, okay? And even just the way he's sitting, you can see this right pelvis. It's a little bit higher and a little bit flatter than this side. So I'm suspecting there's a right pelvis issue, but we'll check. Feet together, open and close the knees. Left side only, please. So when he does the left, the right goes with it, okay? It's getting stuck here, but more on this right SI joint. And we're looking to see which one goes higher. Left side goes higher, right side a little restricted. The shoulder joint is the only joint under 100% neurological control, which means what? If there's any sort of shoulder imbalance or asymmetry, it always starts in the neck, okay, neurologically. I got you. There you go. Look up. I'm just finding that sweet spot. This plate is tight. Drop the hands. There you go. ASIN. Now you just let me bring that shoulder up. Let's go on the knee chest table. I need to get more of that mid back. Belly button down. Good. Wow. Drop the tummy a little more. That's it. Come up slowly. Dude, I gotta chisel that thing away. Let's do the base. This one's light. I just want to stimulate that nerve to the right shoulder. That's it. From just that, I want to retest the shoulders. Let me do the work. Raise them up. We're going to do the wing bone. Now, this happens on full expiration. When I tell you to, you'll take a deep breath in and blow it out fast, okay?
Sure.
There you go. Deep breath in, blow it out. There you go. That's all. Thanks, Vivian.
Killed it, Vivian.
This hand goes on the belly button, setting the anterior shoulder slightly. That's it. You okay?
Yeah, I'm good. It's pretty good.
Okay.
It's pretty solid.
Cool.
Appreciate you.
I'll see you in a day or so, okay?
In my mid-back area, if I'm laying down on my stomach
Okay.
for whatever period of time, getting up, my back will like have a sharp, tense pain and like I can't move. And my shoulder, a really sharp pain here because we work out a lot.
Accidents, traumas, hospitalizations, broken bones.
Broken collarbone.
Same side of the issue you're having, right?
Yeah.
Okay.
Yeah.
So let's visualize first what's going on. Can I have you do some lateral arm raises out to the side? Hold it there. Drop them down now, all the way, and let them relax. So his is also similar. He's got that posterior lateral scapula. The twist is coming from here. So it looks to me like you're actually more of a stomach sleeper. Okay, you're passing out. It's actually one of the worst things you can be doing. You do have to change that.
Okay, cool.
Side sleep, just put a pillow or somebody between your legs.
Okay.
Spooning is actually a good thing. The girl's got it right. His normal posture, same thing. No curve here. No curve here. Kinks this way, comes back. Goes like this, and then his whole head is turned that way and the right ear is up. Potential right atlas or C2 PRS. You okay there, right?
Mm-hmm.
So yours is here on the right. Your boy was tough to adjust, dude. Freaking tough. Okay, so I'm getting here, 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 and the base. So we're getting right atlas, we're getting C7, T1, we're getting around T8, T9, and we're getting sacrum. Let's look at tissue changes. Tissue changes start right there, and it goes into here. Tender there or there. They're both, that one's hot.
Yeah, that one's a little.
That's hot.
More tender.
1, 2, 3, 4, 5. You need to be like this. That should be your normal, by the way.
Great
Okay?
posture right here.
Yeah, that should be your normal. Close your knees, please. Open wide and close. Left side only. You got a little bit of the SI, but yours is more coming from the sacrum. Let's isolate the upper cervical, go in flexion. So I'm getting it on the bottom left. See the difference there?
Mm-hmm. That's really tender too.
You have what's called a critical atlas, my friend.
Critical atlas.
Critical atlas, dude, let me explain it.
Alright.
So we have C2 on the right, we have atlas on the left.
Okay.
This is the back of the skull here.
Okay.
Put your fingers in there, 2, 3 fingers inside. That's the spinal cord.
Okay. Down in there.
If the vertebrae are doing this, what's it doing to the cord? It's compressing.
Yeah.
We're gonna set C2 first, have a stable foundation, and then set atlas across.
Okay.
That's gonna get all the messages going down nicely. Nice and easy, okay? Happy place. This first one's going to be very light there. Gotcha. We're going to set left atlas. Gotcha. ASL. There you go. Home run, dude. Walk it off. Bam! Good stuff. I wish his set like that. Raise your arms out. Slowly lower them now. Down to the side. Guess what, dude?
Even now? Alright, nice.
I don't need to work on your scapula. That's pretty cool. Guess what, dude?
Clear in the middle?
That cleared the middle. Guess what, dude?
What, are we straight down there?
So this didn't follow textbook at all. He had a critical atlas, he had a T5, T6, and he had a sacrum. We set critical atlas, everything cleared. I can work on your pelvis.
Oh, yeah.
Gotcha. Okay, that should feel different. So
Yeah, definitely not as
not as
it was.
stressful on the
Yeah.
spine. Feet together,
Mhm.
open and close the knees, left side only. Beautiful. Right side only. I hope you feel that because they're moving independent now. That's that nub, that's scar tissue, that's an old ankle sprain.
Alright.
Okay? Down. And up. Come on. I said do what I gotta do.
Damn.
Come on, keep going. That's it. Next is going to be passive range of motion. Got him? There you go. Thank you. Ankle. Fibula. There you go. Shoulders are even now. This is more even. Your ears even. Pelvis was the main thing though.
Okay.
Pelvis and upper. So this is part of what's called the parasympathetic nervous system, which is responsible for resting and digesting. This is going to calm you down a little bit,
Okay.
if you need it or not.
Alright, awesome. Thank
Alright,
you.
dude?
I appreciate it, man.
You got it, man. Tell me what the issues are.
Posture. I
Okay.
feel like from phone, computer, my posture's, slouched. If I sit for a while, I get crazy ache in my lower back, especially on planes.
Now, what's interesting, just watching your feet, both toes deviate.
Mm-hmm.
Okay, so it's not that one does and the other one doesn't, right? They
Yeah.
both do. Whenever I see a bilateral issue of anything, I'm always thinking spine first.
Okay.
Okay? So it goes back to that low back pain.
I snore sometimes, which started recently. I never used to snore before.
Okay, we have a little deviated septum, you know, you have this deviated
I have
septum.
no idea.
What's your role in all this?
Rapper?
Oh, is that right?
Yeah.
Okay.
I write songs with Austin too.
Cool. You do a lot of work on the road also? So, we're getting sacrum, we're getting around T8, T9 area here, and we're getting right atlas on him. The tissue changes start here. They go deeper to right there. More tender when I push here or here. I feel it more here. That's your sugar button, buddy. Right side only, I'm feeling it more down in here. I'm getting a lot more swelling in here, right there.
Yeah, this side hurts a lot more when you do that.
Yeah, so we gotta do, this guy's got his poker face on right now for me. He's not even flinching when I do it. I see it. I get you. You tested me. It's okay. I get it. So you didn't get no Magic Mike influence down there?
He's from Miami?
It's all bass, dude.
Like that booty music?
Drop the bass, drop the bass. And then it's just like, boom, boom, boom. You got a lot of swelling here. Is this side more tender or this side more tender?
This side.
Yeah. So he also kicks out that right leg. Okay, that's coming from that right pelvis. We need to deal, and then he pronates on that right side. So we need to deal with right pelvis, T7, atlas, ankle, and both shoulders. Right ASR. Drop that down. There you go. Nice. Part of the digestion and the sugar button, okay? There you go. Relax the shoulders, please. Down. Hands down. Good. You gotta breathe for me, please. Come on, breathe. Don't think so much about it. Happy place. There you go. Keep walking. Keep walking. A little lighter.
Yeah, that's
Like
a little lighter on the
fluid, I mean.
Yeah.
And I need you to just go to your happy place now, okay?
Alright.
Where is it?
Miami.
Miami.
305.
There you go. Come on up. You actually stole my thunder on the setup. Walk it off. So we're doing ASI and ilium. We're going to be doing it on the high-low, stabilizing with my left hand, thrusting with my right. There it is. One more. There you go. Let's set a little deeper. Now you're walking different.
I feel it, yeah.
Now you're up taller. Good. I know.
This is rough.
Dude, he's sweating from what I'm doing right now. 1, 2. Ah! Walk it off, sir. Down. There you go. Ah! There we go. This guy's making me work.
Ooh.
Ah!
You could crack ears, man?
Yeah, man. Wait till you hear your...
Ah!
What's that tone thing?
Woo!
You guys have the... You see how it curves that way.
Mm-hmm.
So we're going, we call it the high side. So what we're going to do is we're going to bring this over, we're going to set it this way, that way. There. Got it. Now, I'm not trying to straighten his nose out on the first adjustment. I'm just trying to get it.
Does it straighten out?
I've straightened out maybe half of them.
I'm good.
You're set for today.
Easy.
Okay?
Thank you, man.
Welcome to the office.
Pleasure.
Yeah.